Hello, today we're going to discuss the healthcare team, which can include several people or very few people. We're going to discuss kind of all the possibilities. So the healthcare team definitely consists of the patient and their family members. Could possibly be caregivers, and those caregivers could either be family or hired caregivers, healthcare providers, such as their doctors or their nurses. Again, there's a huge list. And then also insurance companies, because they often dictate the amount of care given to patients. And also back on caregivers, we need to talk about caregivers that could be in the home, but also caregivers that could be in different types of facilities. The rehab team consists of the PT and PTA, the OT, which is occupational therapist, and the CODA, which is the Certified Occupational Therapy Assistant. SLP is a speech language pathologist, certified orthotist and prosthetist. The PCP would be the primary care provider, then the physician assistant, and possibly the nursing staff. MSW is a medical social worker, ATC is athletic trainer, and then there's ancillary or supportive staff, including aides, volunteers, home health aides, and possibly even students. So you can watch these videos on your own, but we've also talked about the physical therapist, their functions and their duties in the PTA versus PT lecture, but just to review, they function through evaluating the patient, diagnosing, giving that patient a PT diagnosis. They'll also determine the prognosis, the plan of care, any coordination of referrals, and then also how the PTA is going to play a role in each patient's treatment. And we also talked about education, so not just the patient themselves, but also the family members, because this is kind of a team effort. So if family members are taking care of that patient at home, or if they're just going to be kind of a sideline cheerleader, motivating and encouraging that patient to do their exercises or their walking, you also definitely want to educate the family and the patient on any sort of precautions. So things maybe that patient should avoid. And let's see, we already talked about that. And then also the PT will determine and establish short and long-term goals and play an important part in discharge planning and provide prevention strategies. So that definitely comes with the education. So how the patient can take care of themselves, but also prevent further injury or recurrence of the current injury or condition. The PTA will perform those interventions. They will do data collection. They will document daily SOAP notes, and of course consult the PT with any change or findings of concern. And here were some different pictures of PT and PTA working with their patients. The occupational therapists, they're going to be more of a functional activity therapist. So they're going to look at basic motor functions. They also look at cognitive things. Sometimes they'll work with patients on memory and understanding, and then also in work environments. So kind of some different things. In maybe the hospital or skilled nursing facility, they'll work with people in dressing, bathing, showering, things like that. Sometimes they'll need adaptive or assisted devices, and the OT can build all sorts of splints, or they can make things with larger handles, anything that's more adaptive for that patient. Like I said, they do a lot of splinting and orthoses for the upper extremity. They can work in schools just like a PT can, and do ergonomic assessments also that a PT can do. The CODA, which is the occupational therapy assistant, will carry out that plan of care that the OT sets in place. And as you can see, these are more upper extremity activities done with the OTs and the CODAs. It's often a situation, especially in skilled nursing facilities and acute care settings, where PT and PTA may do co-treatments with the OTs or the CODAs, where the OT may work on addressing or a functional upper extremity activity while the PT or PTA works on transferring or ambulating them to the bathroom. So it's not uncommon to see PTs and OTs doing co-treatments. The speech and language pathologist, they'll work with speech, communication, but also with swallowing. So sometimes patients will have different conditions where their swallowing is impaired, so they'll work with different types of fluids, so different consistency of fluids. They may have to thicken their water, or they may be drinking kind of a gelatin type of thing until that person can be trained to drink basically normal fluids. Again, they'll work on speech issues. They'll also work on cognitive. So you'll see the speech therapist sometimes doing co-treatments with the occupational therapist when they're working on cognitive issues. A couple speech pictures. The certified orthotist and prosthetist will make any and all types of orthoses and prostheses. So these can be braces, so upper extremity braces, trunk, lumbar braces. It can be lower extremity AFOs, which are different orthoses to, determine how the foot lands during walking. This usually happens, so they'll be more present in an inpatient setting, but even in the outpatient setting, this is something where if you find a patient in an outpatient setting that requires some sort of orthotic, that you would send out the referral, and most of the time the orthotist will come to the clinic and work with the PT or PTA in fitting a proper orthosis for their patient. These are different types of prostheses. The social worker. When I was doing home health, this medical social worker was my best friend. These people know everything. They have, they know about patients, according to their insurance or their needs, what they could qualify for as far as any sort of home health or assistance in their home, or having accommodations built in their home, so maybe a ramp or a modified shower with bars and stools and different things. They have so many resources, and if there's ever a question, especially during a discharge planning thing, that if you have any question on, supplies or resources or anything, the social worker is the person to ask. They'll also help with transportation issues, so if the patient, can't drive or they don't have family to drive them, they will know what kinds of shuttles or, cabs or whatever that could be available for the patient. The other thing they do also deal with is child and spousal or elder abuse, and that's something we'll talk about a lot more during law and ethics. ATC is the athletic trainer, so that's going to be more your outpatient setting where the athletic trainers definitely trained in that kind of first responder type of thing. When someone has an orthopedic injury at a football game or any sort of sporting event, they're often on the sidelines in those, and then also in the clinic. Of course, physicians, whether they're medical doctors or DOs, which are doctors of naturopathy. They can make medical diagnoses, obviously, and they will order different testing, diagnostics such as imaging or blood tests or nerve conduction. They will also be the ones to refer to PT. Now, again, this is a different lesson, but most PTs have direct access, so they don't have to go to a physician before they see the PT. However, not all insurances honor that, so that will be discussed more in depth later. Different types of specialties that will refer to us. It could be your general practitioner to neurologist, pediatrician, orthopedist, physiatrist. In Washington, PTs and PTAs can take referrals from chiropractors. Then the physician assistant. They're usually the ones that we get to communicate with more than the physician, and they'll assist with surgeries. They'll do routine office visits as well as give different injections. They can prescribe medications or order any additional diagnostics. Registered nurse. Again, you're going to see these more in the acute or inpatient setting, and they're kind of follow through with all the medical plans of care. And then these are some interesting videos kind of to show you not just the differences, but a little bit of the relationship between PT and OT. Okay, oops, thanks so much.